The numbers are staggering. 1 in every 4 adults in America suffers from a mental illness. Getting effective treatment depends on a correct diagnosis, which is why researchers are striving for new ways to accurately pinpoint and treat mental illness.
Worthlessness, hopelessness, being a burden to other people.
The doctor just kept telling me there's nothing wrong with her, and then as she got closer to 4, the fits were just unbelievable.
I just said, why couldn't you let me go? All I wanted to do is die.
Depression, schizophrenia, anxiety, bipolar, just a few of the mental illnesses that afflict 58 million Americans. For many, the first diagnosis is not the right one.
85% of people with mental illnesses are being prescribed their psychiatric medicines by their primary care doctors, often in a 7-minute appointment.
You and I, my mother, and Scott.
Elizabeth Prescott has bipolar disorder, but for 6 years was treated for depression with medications that made her worse.
They send you to places that you would never want to be.
Mental illness is typically diagnosed by just its symptoms.
We basically diagnose people like we did in 1840 when Lincoln got depressed. So psychiatrists are the only medical doctors that never look at the organ that they treat.
But that's gradually changing. Using single photon emission computed tomography or a SPECT scan, doctors see inside the brain.
If you don't look, you miss a lot of very important pieces of information.
Technicians inject patients with a radioactive isotope, and the machine snaps a picture of the brain showing activity in color.
We think he was bipolar.
Bipolar, because of the amount of red indicating too much activity. Compare that to the image on top, which shows little red, a sign of brain damage.
By showing them the image, the shame and guilt that goes along with mental illness melts away, and their compliance goes up because they develop what I call brain envy. You know, they want a better brain.
Let's brush your hair. Becca, let's brush your hair, okay?
Mental illness has no age restrictions.
She would pick up her younger sister and throw her, and her sister was only like 7 months old at the time.
Temper tantrums from the get-go.
Rebecca O'Banion and Justina Eitan struggle raising children diagnosed with bipolar disorder.
She will go from laughing, crying, to screaming all in within an hour sometimes.
If I try to control him, I'm going to get hurt because there's kicking, there's punching, there's biting.
When Ian was 5, doctors thought he had ADHD and gave him medications. His mom said made him psychotic.
He was screaming at the top of his lungs in the middle of the night that there were people in his head.
In recent years, there has been a 40-fold increase in the diagnosis of bipolar kids, making it more common than depression.
The fact is that it had gone up so incredibly in the last 10 years, it's hard to believe all of those are true cases.
Dr. Gabrielle Carlson says only 1 in 5 children referred to her for bipolar actually has it.
What is more common in children are episodes of irritable, explosive, very difficult behavior, which may be set into a context of other kinds of problems like attention deficit or anxiety or depression.
Maybe there is overdiagnosis, but there's certainly also underdiagnosis for those that don't recognize it. And there's misdiagnosis, which means it may not end up being the classic bipolar, but it's something.
That something else could be a condition called mood dysregulation, which has similar symptoms to bipolar disorder, minus the mania.
Rebecca, look at me.
There's still a lot to learn about diagnosing and treating mental illness. What's discovered will affect the future for children like Rebecca and Ian.
My hope for Ian is that he'll be able to live as normal a life as possible.
We just want her to live a successful, productive life.